Good afternoon. Welcome to our Binational Health Week community forum today. We're here to talk about another important resource in our community. Today we are welcoming in Ana Camarena. Welcome, Ana.
Hi, everyone. Thank you for being here. And I look forward to the talk.
Thank you. And so Ana Camarena is from the Community Health Partnerships, and she's a community health worker in our community. Thank you for the work you do. And she'll be sharing some of the resources that her organization provides, and we'll be able to ask her any questions. So if you are joining us, please feel free to put in any question you might have in the comments, and we will hopefully have time to get through them all today. Remember, we are here to talk about the community resources provided through Community Health Partnerships by National Health Week. And so I know we have other type of community forums, and we will have, I know there's important announcements that also went out today on behalf of the county, and we will be addressing those next Wednesday at our community forum then. So yes, welcome again to everyone, our audience, and Ana. Ana, I understand you have a presentation for us, so we'll let you do that presentation, and it might spark up some questions for our audience. Feel free again to leave your questions there, and then we'll do questions and answers at the end, if that's okay with you.
That sounds great. Yeah, let's get going.
Great. All right. And then just to let our audience know, we have Gloria Pacheco behind the scenes that's helping us work the magic, and also put our presentation here on our screen, and there we go. Okay. All right.
Thank
I'll let you
you.
take it away.
Yeah, so thank you, Corina and Gloria. I'm again very happy to be here. Again, I'm a community health worker with Community Health Partnership, and we advocate for affordable and accessible healthcare services for our diverse and multicultural communities, regardless of socioeconomic, ethnic, religious, and cultural background, and support our member organizations in achieving these goals. Our work is guided by the level of benefits to our members of the community health centers. Next. Today's agenda will be going over Medicare Basics, eligibility, original Medicare, which is also called Part A and Part B, and Medicare Part C, Medicare prescription, which is Part D, Medi coverage, important dates for you to know and be aware of, and how can we assist you as CHP workers. Next. Community Health Partnership has a various clinics that we work with. On your screen, you'll see Aki, Rotary Care Club, Garner, Mayfair, Ravenswood, Peninsula, Indian Health, School Health, Northeast. These are our community health clinics that we work with. Next. Continue with Medicare Basics. What it is, it started in 1965 by President Lyndon Johnson. It's a federal health insurance program for individuals 65 years of age and older. Medicare is financed by payroll taxes, Medicare co-payments, and monthly premiums from Medicare. It's deducted from Social Security benefits as well. Eligibility. So how do we qualify for this program? So first of all, we have to be obviously 65 years or older. Be an individual that has maybe certain disabilities, end-stage renal disease, otherwise known as kidney failure, must be a permanent resident or a U.S. citizen. And there are some work requirements to that. Briefly, it's either 10 years or 40 work orders. Next. The individual is eligible to enroll to Medicare through 3 months before the 65th birthday. The month of their birthday and the 3 months after their 65th birthday. So 3 months before and 3 months after the 65th birthday. The initial enrollment period is the 7-month period. You're automatically enrolled into Medicare if individual receives Social Security or railroad retirement benefits. Otherwise, individual will need to sign up for Medicare when they get closer to 65 years. Disabled individuals under 65 automatically receive Medicare. the month after they receive their Social Security benefits for 24 consecutive months. So let's say you're 50 or 45 and maybe you become disabled. So once you receive your Social Security benefits, then that's when the Medicare pops in for you. Again, end-stage renal disease with dialysis or have received a kidney transplant. Medicare coverage for kidney failure ends 12 months after an individual stops dialysis or 36 months after receiving a kidney transplant. Let's go on to Part A and B, which is also called the traditional or the original Medicare. Part A is hospital. So what does Part A cover? Well, there's no premiums. There are some exceptions. However, again, there's no premiums. Inpatient care at hospitals, skilled nursing facilities, hospice care, home health, and blood work or laboratory services. Part B, so covers services from doctors and other healthcare providers, outpatient care, durable medical equipment, that would be like wheelchairs or a hospital bed, preventive services, ambulance, chiropractic services. Not covered by Part A and Part B. It's long-term care, routine dental care, cosmetic surgery, obviously, acupuncture, hearing aids, and routine foot care. The premium, as of last year, 2020, it started at 144 and 60 cents. However, if you do qualify for Medi-Cal, the actual premium is waived. Part C, also known as Medicare Advantage. To receive Part C, you must have Part A and Part B. Now, the premium is based on the region, the zip code, although that sometimes you will have a zero premium depending on the area. Part D is also known as prescription drugs, and it's bundled into these plans. Continue on with Part D, optional. It is optional, so must be entitled to Part A and be enrolled in Part B. Helps cover the cost of prescription drugs or will lower actually the cost. It's a permanent premium penalty of 1% times the number of full uncovered months an individual didn't have Part D or credible coverage. So there is a penalty for that. So let's maybe take a note on that. If an individual gets extra help, otherwise known as LIS, then the individual doesn't have to pay the penalty. Now, Medi, also called as Medicare Medi-Cal, is when an individual is enrolled into Medicare and Medi-Cal. So it's almost like they have dual coverage. Benefits of Medi, individuals are covered 100% and shouldn't see a bill ever. 100% of the copays and deductibles are covered when participating in Medi-Cal and Medicare provider networks. Now, important dates to remember. If you notice, the first one says annual enrollment period. We're actually in the annual enrollment period now. It started October the 15th and it goes on to December the 17th. It goes on to cover Part C, Advantage plans, and Part D, prescription drugs. Now, the initial enrollment period, again, is when it's for a new individual who maybe has 165 joins in. There's a 7-month period that varies from person to person, depending on the month of their birthday. There's only one-time enrollment choice, or they can wait into the annual enrollment period. Special circumstances. So they do consider perhaps if you move, then you're able to enroll whenever or change plans whenever you're able to. General enrollment period is from January the 1st through March 31st. If, for example, you missed your initial enrollment period or your special enrollment period, you get another chance to enroll in Part A and B. And the coverage will start July the 1st. So what can CHP staff help you with? Well, our staff can have a conversation with you around Medi-Cal and Medicare and kind of give you an overview of each plan. We'll go over Medicare Premium Overview, Parts A, B, and C, and D. We connect you with a Health Live agent when you are ready to enroll or would like more information to your unique circumstances. You have the freedom to select your provider. That's important to know. Health and Life agents help you make the informed decision about the plan that's best suited for you. And they help you enroll as well. And you are now seeing my my name with my information. You have Ana Camarena with my email and my number. And then also to your left, or maybe it's to your right on your screen, you also see my counterpart, which is Lupe Yepes. She's our health educator with the number there and her email address. And I believe that's it. Yes, thank you.
Great. Thank you so much, Ana. And I understand that Ricardo has joined us, so we're going to bring
Awesome.
Ricardo in as well. I do have a couple questions. Welcome, Ricardo.
Thank you so much, Corina.
I know you're busy out there with a lot of the county work, so thank you for everything you do with our county and translating in Spanish and all the good things. So we had Ana come and present to us about her organization, Ricardo. I know Binational Health Week, you know, we're already past the halfway mark of this month, which is exciting. I know you've all done amazing events with a lot of resources being provided to our community. And so maybe before we go into our questions and answers with Ana and maybe yourself, Ricardo, if anybody has questions for you, maybe you can give us an update as to, you know, some of the events that have happened and maybe some of the events that will be happening till the end of this month.
Of course. So first of all, thank you so much, everybody, for tuning in into our Binational Health Week community segment here that we have within the county. And thank you so much to Community Health Partnership for being here today and being able to provide us with all that great information that we just learned about. And yeah, so Binational Health Week is actually a movement of different community organizations as well of federal agencies, including El Consulado Mexicano here in San Jose and the Public Health Department here in Santa Clara County, in where we all come together to provide resources and health screenings to our community, specifically the Latinx community who live here in Santa Clara County, who perhaps may not have access to healthcare or to resources or to health education. Throughout the month of October, we do a series of events in where we try to bring all these services to our community where the community is. We started the month of October this year with a kickoff event, which we called the kickoff event of Binational Health Week, and that took place on October 2nd at the Blanca Alvarado Resource Center in Eastside San Jose, in where we were able to provide COVID-19 vaccines, HIV and STD screenings, as well as glucose screenings, flu shots, and many other information and resources to our community, as well as highlight the resource center of Blanca Alvarado there in the east side of San Jose. And throughout the entire month of October, we've been having different events and webinars as well, hosted by our multiple community partners. And as a matter of fact, we're having our next event next Monday, which is with the Escuela Popular that's happening, will be on October 25th. And we'll be starting at 8 a.m. There will be a morning health fair, and then another one at 5 o'clock, 5 to 8 p.m. And again, this is at the Escuela Popular, also located in East Side San Jose, in where many of our community partners will be present. So we hope that people can join us at that event. And then next week pretty much is the end of October already. This month has been flying by, definitely, for sure. And we want to make sure to thank people for their commitment and for showing up to our events. We will be also having a virtual ceremony in where we will highlight most of the accomplishments that we have done here in Santa Clara County during this entire month of October 2021.
Wow, that sounds wonderful. Thank you for everything that you're all coordinating on behalf of our community and for our community. And Ana, I'm going to be waiting for any questions and comments by the audience, but we also have some questions for you if you can help us answer. In regards to the many resources that you all provide, do you also provide any resources or do you have any information on for community members that might not qualify for Medicare, such as undocumented workers and maybe any other, undocumented immigrants, and maybe other resources for the undocumented immigrant community?
We do. We try and offer a variety of services for everyone in the community since we're such a multicultural community. We work with many of the clinics that I showed you earlier. And one of the programs that we offer is called a PCAP. And that program itself is for someone that maybe is not documented. And it's a sliding fee scale. They receive a card and they're able to see the doctor for a minimal fee.
Great. And I think we have a flyer here
Yes.
in regards to that program. And I know you shared a lot of your partners in the community, which are also reflected here. And so thank you, so much for gathering all these resources for our communities to have access to. Perfect. And thank you for highlighting that. And you specifically at Community Health Partnerships, I know Ricardo did a great job of highlighting, the events that have happened and are coming up. Does Community Health Partnership have any, whether it's virtual gatherings or any specific gatherings that you're all a part of in the upcoming weeks?
We actually do. Actually, Ricardo mentioned that he'll be at the Escuela Popular on Monday. We'll actually be there as well. We actually were at Binational fair a couple weeks ago, and next week we'll also be at two trunk or treat events, and I can send those out. One of them is at the Alum Rock Library. The other one is at the Reed Hillview Library, and there's another one at the Masonic Temple. But I will be able to send those out to you. That way everybody has the information that they need.
Great. Thank you, Ana. And community, make sure to look out for that flyer. We'll make sure to put it out on our social media posts with that information for the trunk or treat, which sounds like fun, for all of our families. And, I'm wondering, do you all also provide this information in various languages such as Spanish, Vietnamese?
We do. We have staff that is bilingual in English and Spanish, as well as Vietnamese. And so those are the languages that we currently serve. We also, Aki actually has Aki and Numi actually have staff that are either Mandarin and Cantonese speakers as well.
Great. And I also, work with all these organizations in the community one way, shape, or form. And I also know that, like you mentioned, they're not just bilingual or trilingual, but also bicultural or tricultural. And so that's beautiful, that we're able to connect in our communities in these different ways. Thank you, Ana. And then Ricardo, I don't know anything that you want to ask Ana. I know our audience is being really quiet today. I don't see any questions yet. But any questions or maybe even comments you want to add, Ricardo?
Yeah. So Ana, if you can tell us a little bit about maybe somebody just tuned into our show right now. Is there any specific website that they can visit in order for them to find out more information or phone number that they can call?
Sure, they can actually call me directly, and I'd be more than happy to either talk to them on the phone or maybe do a Zoom call with them. And we can always do like a preliminary overview of what programs they might be able to qualify. My direct line is 408-579-6009. And again, that's 408-579-6009.
Excellent. And in regards to the services, you listed a lot of services that you provide. Now, do all of the community partners or agencies that you collaborate with offer the same amount of services, or does it depend per organization?
No, they actually are all clinics. We partner with them, and they pretty much all service our community, again, regardless of language or ethnicity or social status. We all have the capacity to serve in whatever form that they need to be served.
Excellent. And are there any specific messages that you want to put out to our community members today in terms of your services, or what would be the call to action that you would like to share with our community?
Sure. I would say, if you think you qualify for a program, go ahead and apply, because I know so many people have said, well, I applied, I don't know, 2 years ago or maybe last year. We got to remember that with each administration, things change, but also policies and procedures, let's say for Medi-Cal and Medicare, have changed. So maybe you didn't qualify in the past, however, you might qualify now. And I always encourage people to, give it a second shot and apply, because you might be able to get services that perhaps you didn't know you qualified for.
That is so interesting, and thank you for sharing that, because many of the times that does happen in our community, specifically in the Latinx community. It's just we say, oh, I already applied and I already know that I qualified, but that could have been information from last year's previous
Correct.
administrations, and at this point there might be a new policy or new law that actually allows them to qualify. So that is a really great point that you highlighted there, so thank you for that.
Right. And Ricardo, also things have also changed with COVID. So things have changed not only for the Medi-Cal, but also for other services in the realm of providing more services because of COVID, and people have been unemployed, and it's been a lot for the community. So there's a lot that we can actually offer the community.
Absolutely, yes. It is. These are difficult times that we're all currently facing, and we want to make sure that our community primarily knows where these resources are. So can you remind us again, what is the best number to call you, or what is the website that we can visit, or if you have social media that we can follow?
We do have social media. You can always look us up we have a Facebook page, so Community Health Partnership. You can also give me a call directly. If I'm not answering, it's because probably I'm out at an event, giving out information to our community. But I'd be happy to talk to you. 408-579-6009. Again, the number is 408-579-6009.
All right, and there you have it. Our community, their phone number is 408-579-6009. It is Community Health Partnership with us today here on Binational Health Week segment. And you could also visit their website, which is chpscc.org, to find more information. Anna, Corina, thank you so much for having us today. And thank you so much, Anna, for joining us and educating our community on your services.
Thank you. It's been a pleasure. Thank you, both of you.
Thank you. All right. Have a great weekend. Bye, everyone.
Bye, everybody.